All right, welcome back everybody to another exciting episode of AI Data Mastery, where we are looking at all the cool and exciting ways AI and data are helping B2B businesses, as well as shedding light on those unsexy businesses that just most people don't even know about, but literally help the world go round. Quick thanks to our two sponsors, Data Accelerator and Evolve with AI. Thanks for helping us keep the lights on. I'm your host, Jason Renno, and today I'm joined by Nathalya Mamane. She's founder of Anywhere DX, and this company is it's incredible. I can't wait for her to start talking about it. But really what they're doing is they're building out an in-home diagnostic that can detect infectious diseases from saliva, starting with strep throat and then connecting patients directly into virtual care. So from a parent standpoint, from a patient standpoint, having to go to work on a daily basis, I mean, this is the kind of healthcare innovation that is going to save us parents and people time, money, and a whole lot of unnecessary urgent care chaos and co-pays and everything else that's involved, right?
I love how you framed it because that's exactly what we're doing.
Well, perfect. Well, welcome to the show here. Without
Thank you
further
so
ado,
much.
thank you so much for being here. And yeah, welcome to the show. I'm excited.
I'm super excited to be here. Thank you so much for having me.
Wonderful. So I know with the intro we kind of highlighted the problem that you're solving, but can you maybe dig a little bit deeper into that? What made you start the company? What was the big problem that you saw that you wanted to solve? Where did we how did we get to this point, so to speak?
So, I'm a mother of four children. Now my children are a little older, but I went through this experience, I don't even know, hundreds of times over their lifetime. And, it kind of is the same movie over and over again. Like they wake up, they're sick, they have fever, you look at your schedule and you're like, shoot. What is this day going to look like? So the first thing you do is you have to cancel all your appointments. And this was the time before Zoom, right? This was the time where if you had an appointment, you had to go to the appointment. So
Yeah.
if you had a sick child, you had to stay home and there was no other option. Now, on top of having to stay home, you had to find out what your child had so that you could actually go to your appointments the next day and actually have a regular routine the next day. So again, the movie was the same. The child wakes up in the morning, your day is shot, you have to cancel all your appointments, you have to make an appointment, you have to find an appointment to go to. Hopefully your pediatrician's available. Chances are they're not that day because that's what our luck gives us. And then you have to go to the appointment, wait in a waiting room with a whole bunch of kids who are just, if not worse, even more sick,
Exactly.
giving you the risk of getting sick yourself and being in that same situation just a couple of days later that you're going to give to your other children. Like that's the drill, right? That's the drill. And believe it or not, my kids are now, out of the house. I'm an empty nester, recent empty nester, and it hasn't changed. It literally hasn't changed. Now here I am in Boston, and this brought me back memories yesterday. I'm in Boston, and we got, as you heard, a huge blizzard, right? We're buried under 2 feet of snow. And years ago, I had to do the exact same thing the day of a blizzard, shoveling my car out, right, from under the snow to be able, I'd like super early in the morning so that at 8 o'clock in the morning, my doctor would answer and say, okay, come at 10. And that was if I was lucky, right? If I was unlucky, it was like 4 in the afternoon, but that's besides the point. Things haven't changed, right? It's been over 10 years of this happening to me because it brought me back memories of being buried in the snow, and it hasn't changed. So I'm not the only one experiencing this. Every single parent
I was going to say, I'm sure any parent listening can completely relate.
they can completely relate because guess what? Nothing's changed. Nothing's changed. Young parents are experiencing the same thing as I experienced when my kids were younger. They have to go to the doctor. And what has changed, however, is the fact that I only had a $25 copay. That was when things were cheap. Going to the doctor was cheap, right? Remember when we had $25 copays or $15 copays? By the way, that doesn't exist anymore because my deductible and the deductible of so many is in the $5 to $6 to $7 to $8,000 range, right? Me also. So getting
And
your
what,
kid
90 to $120 copays now? It's like,
last time I had, by the way, I am a victim of having had strep in the last year and it hurts like hell. It cost me $350 on a Saturday morning because my only option was urgent care. Like we are in the world of innovation, and yet this very simple process hasn't changed.
Since
it's
what,
time.
1962?
Well, since they developed that like antigen rapid test, right? That they do in the doctor's office to sort of like screen the child. So it's time for a change. And it was time for a change for me. And as I dug more into it, I realized it's time for a change for everybody. And this goes way deeper. Like it's whatever you need checked, whether you have a UTI, you have to go to the doctor. I took my daughter to urgent care not long ago, $375 for her to do what? Pee in a cup. Seriously? Like we need to now, give back control to the parent and give back control to the consumer by giving them tools, simple tools, inexpensive tools, yet reliable tools that allow them to not have to go through this chaos at every single time there is a symptom. Like this.
Yeah, my wife and I were just talking about it the other day, because at the middle school that my son goes to, if he's not in school, you can't just say he's sick. You have to provide a doctor's note. And I'm thinking,
I still have those.
I guess. I mean, I don't know. I mean, we just moved down here to San Diego, so we're new to the school district. But I'm like, really? So like, if my kid's sick, then I have to take the day off work, take him to a doctor, pay a copay just to get a note, when I could literally stick a thermometer in his mouth or feel his temperature and, hey, he's got 102 temperature, he's sick. I don't need a doctor to tell me that. I don't need to pay $100 copay. And it's just, but again, it's just such an outdated system.
Completely outdated.
And there's so many options out there with not just AI, but just all the different tools. And, obviously AI is a piece of a lot of things, but there's just such a much more efficient and cost-effective way to do things.
I spoke to a parent, I don't know, last week or something, and she has 2 little kids, and I feel so bad for her. She's been like, there's been illness within the compound of her home, like constantly since winter started back in September, we're going to say, since her kids started school. And most recently, she thought her kid was sick. So they go to the doctor and they got tested for the flu, for RSV, and for strep, and for COVID. I was shocked to hear it cost her $1,500 in tests. I was like, for real? $1,500? And she's privileged. I mean, let's be honest. You and we're privileged, but you have other parents who will wait. They'll just wait, and hopefully it'll just like go away, and the child will feel better, or they'll feel better, and they'll just go on with their lives, or like pump them.
And sometimes it does, but then other times it leads to ammonia and worse things, right?
100%. And I'll give you an example from my daughter. Like strep, is so easily treatable. Simple antibiotics. However, the process of getting tested and diagnosed and treated is, it's a pain.
Annoying as heck.
And annoying, right? And all the words that you want to use. But I don't remember, but she must have had strep, and I must have not gotten her tested because she didn't have the symptoms, the symptoms that I was familiar with. Anyway, what happened with her, and it's not that common, but it does happen, is that she got better, because everybody eventually gets better, but infections kind of like find their way through. Like they could just go away or they could not. And they could then lodge themselves in different places. Her infection lodged itself in the back, in her lower back, and brought about like tremendous pain that she had to take a whole semester off of college to be able to sustain the pain. We didn't know what she had. Like we thought it was a scoliosis. We thought all these things. Turned out it was strep. It was strep that never really got better.
It never left the body, so to speak, or
never
went away?
left the body. It stayed. That infection kind of like grew somewhere else. And then for others, it could turn into like a whole bunch of different other things, like scarlet fever could bring, heart disease that you can't treat. Like that's the kind of thing. Kidney disease, these are the kind of things that last for life. So it's a very treatable disease, yet you have to treat it. You just have to treat it.
For sure.
And if you don't, then you don't know where it's going to go.
Absolutely. So obviously established there's a gigantic need for this. You're solving a huge problem that's going to save parents probably years on their life from stress, probably some money, at the same time, maybe
Yes.
maybe save a marriage or two at the end of the day, alleviating some stress out of the household. You never know.
Not that far, but who knows?
You never know. I mean, stress does a lot of damage, or financial stress, stressing over your kids being sick. I mean, all of that stuff. It takes a toll on parents, right? So now tell us where you're at in the sense of, I know we had talked about on the pre-show, but where you're at in the sense of FDA approvals, where you're at in a sense of kind of this go-to-market. Where are you at in going to market? And then after that, I want to talk a little bit about like go-to-market strategy, how you're targeting people, who you're going to target, what's the strategy behind that.
Yeah. So this will need to be regulated, right? It's not a screening test, it's a diagnostic test. And the idea is that you want to, and it's very important to tell a difference. Like I was going to
just ask you, can you tell me the difference or just?
Yes, 100%, right? So screening is you find out, and then, you kind of screen for things, and you kind of see if you have something or you don't. And
like
usually
for kind of indicators, right? Maybe.
Correct. You screen, like a rapid antigen test, for instance, is more of a, it's more of a screening test, right? If it's negative, if it's positive, it's positive. But if it's negative, it kind of gives you, you're not quite sure. So you're really screening for the positives, but you're not screening for the negatives. It doesn't give you a good enough negative because the sensitivity levels are pretty low. Take COVID, for instance, right? We could screen every day with these home tests. But if you wanted a actual diagnostic, you would do a lab test, which at the time was a PCR, right? That's a diagnostic test. These screening tests they're not expensive, so you kind of screen, you look for the positive, right? So you rule out the positives, or you rule it, however you want to put it, right? You rule in, or you look for the positives. But if you want a diagnostic, then that's what you have to go into better tests. So what we are providing is a diagnostic test that will allow you so diagnostic test needs to go through FDA. Most screening tests also, because the big fear is people will take a screening test and use it as a diagnostic, and it's not quite right.
Gotcha.
Okay. So it all needs regulatory, all needs to be FDA approved. So at the end of the day, we have to go through FDA, and we will need to go to submit there. And also, we want the doctors to trust it, and we want the doctors to be able to treat based on the diagnostic that it gives you, the results that it gives you. So we will need to do that. Where we are right now is we've de-risked the different components of the end-to-end solution. So from the sample collection to the sample prep to the actual amplification, or the device of how it will amplify inside the device into the readout, all that stuff has been de-risked. And now we are in the process of kind of like putting it all together so that we can actually go through, some kind of clinical trial before we go to FDA. So we want to test it on people that are sick, that are not sick, and see how that compares to what, the gold standards in the market.
Gotcha.
And at that point, we will go through FDA.
What is the timeline on this process?
So, we are in the process of raising capital. So if we were to raise the right amount of capital that we need, we're looking at 2 years from today to launch.
Gotcha. From money in hand to launch is a 2-year process.
2 years, exactly.
Gotcha.
And then, so what does launch mean? What does it mean to go to market, right? And that's where we kind of answer what is our go to market? FDA is not going to approve for this test to go to market straight in the hands of the consumer. They're not going to do that. It's never been done before. So they're not going to be like, we've never gone to the consumer and they've never tested themselves, and now we're going to take it off the hands of the doctors and put it all in the hands of the consumers and let them figure it out. We're definitely not going to do that. There's a process to get there. We have a phased approach to get to market, with an end game of getting it straight in the hands of consumers over the counter.
Gotcha.
So there's a process to do
So
that.
you're saying at first it has to go through doctors, prescribed, recommended, things
Yeah,
of
they'll
that,
prescribe it.
a pharmacist, something along those lines, not something over the counter, basically, to
Right.
start.
So it could be like it will probably start with the doctors, or we the best way to launch this is with the help of telehealth systems or telehealth platforms. That will essentially, if you're sick, you would get online, you would be like, I have these symptoms. They would prescribe the product.
Go to your pharmacy, pick it up, do the swab,
and then maybe it'll go through some proctoring. So maybe that same platform will proctor you and make sure you do it properly. And those phases are not going to be very long, but they do have to happen.
Gotcha.
And at one point into that process, we will submit for direct to consumer over the counter.
Gotcha. Very interesting. Learn a lot on I learn a lot on these shows myself. So then, coming from that obviously client acquisition kind of marketing lens, because obviously you want to but you want to market to and promote and build trust and credibility within doctors and that telehealth space. But then at the same time, to future pace things, you also want to build trust and credibility and a brand in front of the parents, the consumers themselves, right? So it's kind of, and I've had a lot of interviews recently in the health space, whether it's medical device manufacturers, whether it's somebody like yourselves, or whether it's I've had some unique individuals, or not individuals, but unique companies on the show in the healthcare space, and they all say the same thing, that our marketing has to be twofold. Even if they rely on doctors to prescribe, they still need to have trust and credibility and a brand name directly with the patients or the consumers themselves. So it makes marketing kind of tricky. How do I do a B2B marketing and build trust and get people to refer me, but then how to also have a B2C approach, building that same trust and credibility within the end user. And it's sometimes easier said than done, right?
Well, yes, but in our case, we're kind of approaching it a little differently, right? Okay. There's a number of companies out there that are waiting to put their name on the box of a strep test, of an at-home strep test. So the idea is not that I have to build my brand. The idea is that I put the name of a brand that already has a brand recognition.
So you're referring to like white labeling the product.
Exactly. Exactly.
So instead of, hey CVS, buy my product. Hey CVS,
here's my product. Put your name on it.
Tattoo CVS pharmacy all over it and go sell it as your own.
Exactly. Now, what CVS likes to do, which I found out, is they like to have the comparison. So I don't know if you've ever been to the pharmacy. Like if you look at, Motrin, so you have the Motrin brand and then you have the CVS brand. It's the same thing.
Yeah, no, 100%. I mean, it's
the same thing. It's the same thing,
right? Walgreens, CVS, or wherever you're located, Rite Aid, wherever you're at in the world.
Exactly. And what they do is they so Motrin will sell something, I'm making this up, at $25.99, and then CVS will have it at $19.99, right? So I can have
same
it
exact
anywhere.
Active ingredient, just a different packaging, right?
Exactly, it's the same one. So we may want to have something with Anywhere DX and maybe build our brand. But if people want this anyway, so if they have CVS and it's a few dollars less, then they'll just buy that, right? And if they don't, they'll buy ours. So people come in. The idea is that we educate people that is on the market, right? People need to know that this exists.
Because this is available.
Exactly. Now, whether they buy it with the CVS brand or my name,
it's irrelevant to you, right?
It doesn't matter to me.
I love that idea, though, of rather than trying to sell one to one, you're selling one to many, which is a phenomenal, and especially with a a new product like this, and obviously there's sacrificing some revenue because you're not
Of
seeing
course.
that end result. But if you're selling, 10,000 of these at a 25% discount or a 50% discount so somebody else can white label them, that's just as effective as selling five of them or 10 of them or a few hundred of them on your own, right?
Exactly. So take, another telehealth company. I don't want to mention any names because I don't want people to think that we're working with them already. So take a telehealth company. There's a whole bunch of them out there. There's eMed, there's Hims and
When
Hers,
you
there's
say, I was going to
Teladoc.
say, when you say telehealth, you're talking about like a Hims, a Hers, those
Exactly,
type of
like those
companies.
kind of, and there's a lot of them out there,
Of
right?
course.
They will white label it, and they're like, you know what? If we will say that we have this, and then they will call us and we'll prescribe it for them, and then they'll just come right back, and then we'll treat them, right? It's going to be almost automatic. And you're thinking about, we talk about this being a connected solution. It doesn't need, an actual connection, Bluetooth connection to your phone. It doesn't need that. What it needs to be connected to a service that will allow you to get treatment. And so it's not like you're not being seen by a doctor. You're just not going to a doctor. That's
Yeah,
the
so I mean
difference.
the kind of the path is, hey, I'm sick, I think I have strep. The doctor, initially the doctor refers you to the test, or you go into the pharmacy, you get the test. The test is almost immediate, and then you meet with the doctor, show them your test results, and then you can get prescribed the medicine. But that can all happen without ever going to a doctor's office, making a copay, or frankly leaving your house. Obviously you got to drive to the pharmacy and back, but you're not sitting in that doctor's office with 10 other sick people and so on and so forth. And theoretically, you could probably shoot over to the pharmacy on your lunch break and grab the test versus taking the day off too, right? If your kid was home. I mean, it
You
gives you
can be
so
very
many options.
creative.
Well, I'm just saying it just gives you so many options to get through your day now, right?
Exactly. So even if now that we have options of having Zoom, right, which was not the case when my kids were younger. I know it ages me, but it was not the case. Now you can actually stay home with your child and still have a day of work. And that is truly the differentiating factor of where we are now. And then people will say, but hold on a second. If I buy this at say $25, which is really the top, the top price that we want to have it sold for, well, now I have to pay for doctor's a visit. Who's going to, do I have to now get a copay? And I'm like, no. Because what we want to do is we want to integrate the price of the first appointment in the price of the kit. So in fact, for $25, you're not just getting a test, you're getting the diagnostic with a physician virtually and treatment.
Gotcha.
And by the way, you should know that getting antibiotics is free. I know we have large copays, but amoxicillin is actually free. Like I think it costs like $1 to get treated because it's such a, it's so many companies are doing it. It doesn't cost anything. So we're not going to look at the treatment part because that's already nothing. But and I say this as with experience because I do have a $6,000 deductible, and when I buy antibiotics, they were free. So, but in any case. It's a question of having really the full package. It's end to end, from treatment from symptoms to treatment. $25, never leaving your home. It's a dream.
Yeah.
It would be a dream.
It would be a dream. Yeah. It's a, I know it, obviously all the I's have to be dotted, T's have to be crossed, and, everything's done correctly, that time frame's there for a reason, but it's just also at the same time, like, God, it's just such a Captain Obvious solution that should be implemented as quickly as possible. To me, from a consumer standpoint, it's like, why would it take 2 years? Let's, but then again, that's above my pay grade, clearly.
Well, I think what people need to understand is that we're not just building a test, sort of like a rapid test. We're we're developing a true equivalent to a lab test. And just so that you understand the difference, so a rapid test is an antigen test. Those that you used to do for COVID, or the simple strip test that everybody is familiar with. That sensitivity is much, much lower. what we are developing is the equivalent of a PCR. And PCR, for people who don't know, is a expensive machine that sits in a lab that will essentially amplify the sample and look for the DNA and look for the DNA of the disease of the target or the disease that we're looking for. Okay, that's what it's looking for the root of the disease or the target. Okay, in this case, it's strep. Doing an antigen test would have been simple. I don't know that it would have passed at FDA because it doesn't have that sensitivity level that they're looking for. But we are actually doing a test that doctors actually some doctors don't even have in their own offices because you'd have to invest in this very expensive piece of equipment and need to see is it worth it, and then get all these cartridges to be able to use for these targets. So what we are implementing is a single use, fully disposable, inexpensive, reliable test that is equivalent to a lab test. So highly sensitive, and that's where it stops. Nobody needs to redo the test to find out if you'd done it properly. Also, a standard strep exam requires you to take a very long swab, and to swab all the way down the throat. You have to go all the way to tonsils. And swab those tonsils. It makes everybody gag.
I hate that.
I'm sorry. I'm an adult. It makes me gag. These kids just have it much more often. It's not comfortable. We're actually doing it with saliva, which has never been done before either, right? So we are doing that. We're accomplishing in all this in a very small, single-use, disposable, and expensive test. So it does take time to get there, but we are getting there. It's becoming a reality.
Which is phenomenal. And yet I'm a very impatient person just naturally. So I'm always like, well, why does it take that long? But it just seems like such a practical, no-brainer solution that it should be available as quickly as possible, I guess was the point. But what really stood out to me about what you just said is that because when you sometimes think of at home or virtual, you think of maybe something that's kind of less than it's not quite as good as if you go into the doctor, or not quite as good if you just go put your boots on the ground and go walk in somewhere. But what you're saying is there is no sacrifice for quality. If anything, you're making it a more pleasurable experience and just as good, if not better quality than you would get if you go to a doctor's office.
Exactly.
I like that. So there is you're not sacrificing anything by doing this. You're not only saving time, energy, effort, and money, but you're also getting an equally, if not better, test and results for what you're looking for.
And that is how it all started, right? When I was living this problem personally, and I moonshot this, and I'm like, what would I want as a parent that would make this a dream? I put all these pillars, and I haven't wavered from these pillars, which is it needs to be inexpensive, it needs to be easy, no throat swab, which is why we're doing saliva. It needs to be highly, highly, highly sensitive so that doctors can trust it. Otherwise, they're just going to say, why don't you come back? Why don't you come to the office and I'll test you myself? No, we're avoiding this. We don't want to do that, right?
Yeah, well, that completely defeats the purpose, right?
What's the point? And that is then, by the way, that is what screening does, right? So if you were doing a rapid antigen test, you would screen your child with a throat swab, and if it's positive, then you would potentially be able to call your dentist positive. But if it's negative, then they would okay, come back and we'll do a lab test because they're sick. I mean, they're still sick, so the symptoms don't disappear. So I wanted to avoid that. It needed to be as seamless as possible from beginning to end.
Amazing. Sounds like again, it's pretty remarkable what you are looking to accomplish, been able to accomplish, and planning on accomplishing over the next few years here. Congratulations.
Thank you.
I guess we're about to hit that 30-minute mark. I didn't realize time had flown so fast. I guess quick question. One thing that I always ask is fellow entrepreneurs or people like yourselves, what are you, first and foremost, is there anything else that you would like to talk about the business or, anything that we haven't had a chance to talk about yet?
I know, I think I've covered it. I think that, giving you the differences between them and, what we're truly striving for is all the things that I want people to understand and I want them to resonate with. So,
Very cool. Well, again, congratulations. Very exciting. And I can't wait to follow along on the journey and see what happens. And like I tell a lot of guests, we'll have to, I'll set a reminder maybe in 6 to 12 months from now, we'll have you back on the show. You can kind of give us
I'd
an
love that.
update. Here's where we're at. And, kind of reconnect as you go through the process and help you document it and, kind of share with the viewers and the audience as well. But as we're kind of wrapping things up and signing off here, you as a entrepreneur, business owner, and leader, what are you engaging with? I used to ask, what's your favorite book? But nowadays, so many people are into podcasts and YouTube shows and that type of stuff. So what are you engaging with, whether it be books or podcasts or whatever else, to stay sharp, kind of stay on top of things and, be the best version of yourself, so to speak?
So, two things. First, I realized that with the help of ChatGPT, nobody can, you lose your muscle of writing. And so, and I have a really hard time when I want to write an email and I'm writing this email. I'm like, I'm pushing myself to write emails on my own because it's so easy to ask chat to do it for you. So, I'm kind of like going again. I'm sort of taking a step against, using AI to do all my work only because your muscles are kind of atrophying. And so I'm doing that religiously more and more, just so that I can keep my head sharp. But what I'm also doing is I'm trying to read more. And, as a parent and as an entrepreneur, we don't find a lot of time to read. And what I've learned over time is I don't have to read smart books. I don't have to read like meaningful or deep books. I just have to read, right? It's a question about reading. So I'm actually just having fun and reading just novels, but that is really just so that the vocabulary comes back, because I think that with AI we lose our range of vocabulary, and that scares me. Sometimes I'm like thinking of obviously age for women, it doesn't help because you kind of lose some of your words, but so I'm trying to stay sharp by just reading more, and I'm giving myself a book a week to read, whether it's it's a self-help book or just a fun novel, but something that will just keep the vocabulary
And just
going in my
just
head.
keep the brain sharp, right?
Exactly. And we used to think that you need to read certain books to keep, but at this point, there's so many like things helping us be more efficient. I just want to just keep my brain sharper, like just to keep that muscle always turning and like getting these words back into my head that you've lost because chat is using them for you. So that's one. And also, like, what I have done is I drive a lot. I'm in Boston, my family's in Montreal, so I'm often driving these 5 hour, and my kids are in New York. So I find myself driving a lot on my own. So I really, really enjoy listening to podcasts of inspiring people, hearing their story, and that kind of inspires me to kind of look at different perspectives. Because being a founder, especially of a diagnostic company or a biotech company, it's really hard. It's very lonely, and you just want to, you need these boosts of energy and inspiring stories that say, okay, this is a new thing I can start, new thing I can try, right? Getting out of my shell, and so these are the two things that I do that helps myself sort of like to keep growing,
Yeah,
not
just
stalling.
stay motivated, right? What's your go-to podcast, or do you have a go-to podcast or show that you like?
It's called Diary of a CEO.
I think I've seen that
D
one actually. Yeah.
Yeah. The thing is about them is that it's a great podcast. I don't love all episodes, but they're 2 hours long. Like they're super long. So you really have to be on a long drive to be able to appreciate it without any breaks. So the last one, I heard two of his episodes. I think they're great. I also love hearing startup stories. So that's really what I'm about. And also, like, I've sort of launched a crowdfunding campaign. Hopefully parents will want to be part of our journey and invest, any amount of money into our crowdfunding campaign, which is really for two reasons. One is to raise capital, but the other one is to really show early adopters. And so my big challenge right now is to start using social media to kind of amplify the campaign. And so I'm gonna get out of my comfort zone and start making videos and get out there and get myself on social media, which I've never done before. So because this is the kind of thing that I'm kind of working in, to like updating and like upgrading in me.
Well, that's phenomenal. Yeah, and this is well, hopefully this will be the starting off point, right? We'll create a bunch of
Yes.
social media content here, and then you can
Yeah.
take it and run with it.
Yes. So
Well,
I hope that wasn't too long.
no, that was perfect, and it's great. Yeah, I want to say Diary of a CEO. Somebody else had recommended that a while back as well. So it's one I think I've seen an episode or heard an episode or two, but I'll have to check that out tonight when I'm at the gym or something. But anyways,
Two
overall,
hours. 2 hours.
what's that?
They're 2 hours long.
Well, yeah, I mean,
They're super
I
long.
definitely won't be at the gym for 2 hours, that's for sure, but maybe break it up over a couple of days or something.
Yes.
I used to drive a lot more because before we moved here, my kids were a half hour, 45 minutes from their school. But now, being in San Diego here, I mean, I don't even have a car. My family has a couple of cars, but my son and my wife use them predominantly. And I ride an e-bike places and stuff half the
So
time because
fun.
we're so close to everything. And it's
And you
pretty
have the
cool.
weather to do that.
And we have the weather to do that. I did not want to mention it was 78 degrees and sunny here today. I wasn't going to throw that out there.
Okay. It's a beautiful, sunny 39-degree day and the snow's melting. I'm not complaining.
Well, my son's committed to play college lacrosse at Stony Brook on Long Island. So we're sitting here
Great.
today, and he's leaving to go to school with shorts and a t-shirt. And I was like, dude, Stony Brook 27 feels like 16 today. And he's just like, oh, brother, don't remind me.
It's okay. We all survive it. It makes us stronger.
Yeah, exactly. And then, you can, exactly. Yeah, we like the East Coast. We go back there quite a bit. But yeah, we love it back there. So.
Yeah.
Anyways, thank you for your time. This has been a great episode. I mean, just as a parent alone, I love learning about stuff like this coming into the marketplace. Mind you, my kids are grown and older, but it's going to be such an amazing thing for parents and just people in general, just the population in general, to have access to not just this, but I mean, this is one particular case and company that we're talking about, but it's just remarkable how many businesses are out there like yours that are taking out one specific outdated, very just outdated process and bringing it forward and making it so much more effective, efficient, cost effective without sacrificing any quality. That's the main thing, right? Is you're getting everything that you would get, if not more than walking into a doctor's office without ever leaving your house. That's what really stands out to me about this.
Well, just one last little thing is I remember years and years ago, way before this, I had heard the CEO, the founder of Waze. Remember Waze? They had
I use it all the time. Yeah.
All right. Well, it was acquired by Google, but he sat there with a room of 1,000 people, and he said the best ideas come from the biggest pain points. And he says, I hate traffic, so I had to do something to help me avoid traffic, and he did, right? My biggest pain point was exactly this. It was seriously another day of losing to go to the doctor.
Another doctor's office, another
doctor's office, and that the same movie again, because the movie doesn't change, by the way. It doesn't get better. It just repeats itself. It's like rinse and repeat.
Well, it's like, what they say, like the sequel or the third or the fourth, it just gets worse as it keeps going, right? It doesn't get any better. By the time you have, I don't know, whatever movie, Rocky 6 or whatever, right? Obviously wasn't nearly as good as Rocky 1, 2, or 3, that type of deal.
Just, when you have 4 kids, I don't know how many kids you have, but when I have 4 kids, and the nurse would be like, oh, it's you again. And I'm like, don't even mention it.
Yeah. I have 2 boys, but yeah, it's, yes, the more kids, obviously, the bigger problem this is.
It just feels like, COVID allowed us, opened the door to these kind of opportunities, because before COVID, if we had not had COVID, this would have never changed. It would have stayed the same. But COVID, showed all of us that you can do this from home. People are smart enough to do a test from home. And so we're going for it.
Well, Thank you for allowing me to interview and be a part of this journey. Can't wait to interview you again in a few months from now, or 6 to 12 months from now. We'll reconnect and we'll obviously stay in touch in the meantime. And then remind the audience of the website. It's
It's anywhere.health.
Anywhere.health.
Anywhere.health. So you can test anywhere. So anywhere.health.
Perfect.
And our crowdfunding campaign is on WeFunder. It's WeFunder/anywhere. Anywhere DX, I believe, but I'll give it to you and then you can.
Yeah, I'll put it in the show notes and stuff. So again, thank you so much for sharing your journey with us. Can't appreciate you allowing us to be a part of this, somewhat initial step here, and can't wait to see what happens. For everybody listening, thank you so much for listening in. Don't forget to like, subscribe, and follow us wherever social media platform you're on right now. Thank you for your time. Stay tuned for another episode in a few days from now. And thank you all for signing in. Appreciate you, and talk to everyone again soon. Take care.